As an emergency nurse, I go to work every day wanting to make a difference, keeping the community safe. Some emergencies are obvious, like heart attacks, strokes, major trauma, but other emergencies might not be at the front of our minds. However, these patients are no less important. Patients being able to access antiretroviral medications as post-exposure prophylaxis, or PEP, after an exposure to HIV might not be the first scenario that jumps to our mind as emergency department clinicians. In fact, many of my colleagues, experienced doctors and nurses, were not aware that our department is an approved and advertised access point for HIV PEP starter packs, particularly outside of normal business hours. Evidence shows us that PEP medication can prevent a person seroconverting and becoming HIV positive even after a high-risk exposure to HIV, but only if commenced as soon as possible and before 72 hours have passed. HIV post-exposure prophylaxis is a time-critical presentation. Experience shows us that HIV PEP is an occasional scenario for emergency departments, but the stakes are high. I describe it as low volume but high impact events for emergency staff. How we handle patients presenting to ED seeking PEP can determine whether or not that person is to live with HIV for the rest of their life or not. In summary, allocating triage category 3, providing any first aid relevant, conducting a risk assessment and initiating a 5-day starter pack. We can also provide other prophylaxis if needed, offer some advice about safer practices, and then refer them on to a specialist service for appropriate follow-up and to complete the 28 days of medication. It's in and out, no waiting for infectious disease team review, no admission, but so very important. SA Health has recently released updated guidelines for HIV PEP, and Standard Operating Procedure number 2 will be of particular interest to us because it clearly outlines correct management of HIV PEP for emergency clinicians. Finally, our patients are people first. It is vital that our approach is judgment-free, regardless of their reason for seeking PEP. Whether it is condomless sex with a person known to be or potentially HIV positive, whether it's injecting drug use or a sexual assault, patients should feel affirmed that they have done the right thing seeking PEP, looking after their own health. I'm proud of the work we do, and I know that we can make a difference for this cohort of our community who seek our help in a time of need.